Of Jiangsu will force travelers who visited 24 key coronavirus-infected countries over the last 2 weeks to undergo 14 days of quarantine and observation in medical facilities. China reported 39 new cases of coronavirus on Thursday, all of which had arrived from abroad, so it's imported cases. The total number of confirmed imported infections has reached 228. Let's get the very latest now. Patrick Fok is in Beijing, China. Patrick, a very good morning to you. Is it afternoon there where you are? Talk to us about this reports that we're getting from Hubei province, China's epicenter with regards to COVID-19, reporting zero cases, new cases for the first time. Are people breathing easily?
Well, not just for the first time, as a matter of fact. This is the second day in a row that there have been zero cases of local infections. And also, remarkably, we're down to just 7 deaths. So we have come a long way here in China, considering where we were a couple of months ago. And there have, as we know, been tens of thousands, around 80,000 people in total that have succumbed to this disease and been infected at some point. But the difficult situation that authorities are managing right now is imported cases of infections. There have been 39 new cases of imported infections in the last 24 hours. That might not sound an awful lot when you think of the scale of this outbreak just a couple of months ago. But then again, remember 2 days ago, it stood at just 12. Now, one thing that we aren't being told about is whether or not these imported cases, and it's happening in these major cities like Shanghai and Beijing. This is where most of these reported imported cases are coming in. One thing that is critical is we don't know at this point, are these people being caught as they're arriving in China, or are they already out in the open? Of course, authorities have tightened movements around the city to people that are returning to China right now. But, this could be a significant issue. And at the moment, the country is by no means out of the woods.
Yeah. So, look, second day, no new cases of COVID-19 in terms of internal transmission. So are you saying movement is still very much restricted?
Yeah, well, in Hubei province and Wuhan city in particular, they are starting to lift some of those restrictions, trying to get traffic up and running again, letting people go about their business. But there are some significant steps that they have been taking in major cities like Beijing. As I say, these are the sort of critical points of entry where, if there is going to be a second wave, this is where it's looking likely it could happen because of these returnees. So last week, authorities said that people could come back and they could self-isolate in their homes. That situation changed on Sunday. They told people that they had to come back and undergo quarantine in designated facilities, and they would have to pay for this themselves as well. So that's obviously designed to discourage people perhaps from coming back to China at all. In Hong Kong, they've undertaken similar sort of steps. As of Thursday, people are having to quarantine on return to Hong Kong. They're being tagged electronically. And of course, this is all about how well authorities can monitor this sort of thing. Because if you have people breaking these quarantining rules, then it's going to be all the more difficult to try and contain the outbreak at this point.
Patrick, at what point will movement restrictions be lifted, especially in provinces like Hubei? Reports suggest that government is waiting for at least 14 days of no new infections and then probably re-look at lifting up certain restrictions. Is that the case?
Yeah, that's right. That 14 days without any new cases is what they're talking about at this point. But, we just don't know if we're going to get to 14 days without any new infections for now. That, again, depends on how well authorities are monitoring these new cases. But, the government is also under some pressure to get life back to normal in China, if you like. People are fed up with the lockdowns. Some people fed up with having to pay high prices for things like groceries and so on and so forth, because there are businesses that have taken advantage of the situation. And of course, people just want to get back to normal life. It's been, 2 or 3 months now that this has been going on. So you can imagine the government has a difficult situation on its hands because, it doesn't want to let its guard down right now. But if there were a second wave of this disease to come about, then a lot of people are going to be saying, well, why exactly did we go through all this pain and suffering and decimated businesses and done real damage to the economy if we're only going to fall back into the situation we were in before? So, a bit of a juggling act for authorities right now, as I say.
And what's it like for journalists working in China, Patrick? I understand that you yourself had to self-quarantine in Beijing. What was it like for you?
Yeah, that's right. I am talking to you right from my living room. We're halfway through quarantining. Lucky in a way that we managed to make it back into China before we had to go into designated facilities. But it isn't easy. The weather, as you can see, is fantastic outside, and after sort of day 2 or 3, you're itching to get outdoors. But I think most people undergoing this situation now as well realize that it's the responsible thing to do, and it's really for the greater good. For reporters right now, the situation is a bit uncertain. Of course, there's been this spat going on between the US and China. Just a few days ago, China effectively expelled journalists from 3 major US news outlets. So it's gotten people perhaps a little bit nervy about their reporting on the coronavirus. This stemmed, one might argue, from a report that was published by the Wall Street Journal just a month or 2 ago about China being the sick man of Asia. And so that's really resulted in a bit of a backlash, and that's why there's been this tension between the two countries.
What sort of reaction are you getting from the ordinary folks there, Patrick, with regards to what US President Donald Trump has been saying, calling it the China virus? I know the WHO keeps on saying, and other organizations, when you talk like that, you often stigmatize people by calling it the China virus. What's been the reaction there?
Well, certainly people here aren't happy about that at all. You can imagine that nobody wants it to be labelled. And, of course, there's been a lot of discussion here about the sort of discrimination. The WHO's talked about that as well, discrimination that Chinese and Asians have faced because of this outbreak. So the last thing that people want here is for the disease to be labelled COVID, the Chinese virus, or the Wuhan virus, as some people are saying. So you can understand why a lot of people here are upset with Americans and Donald Trump, and Mike Pompeo in particular has been referring it as that, especially. But at the same time, it's a bit of a two-way street. Obviously, China has been, or certainly some officials here have been pushing this conspiracy theory that the outbreak might even have occurred in the US. There's no reason, from what we know, to think that is the case, but it is something that's being pushed here to an extent, and that makes things difficult because it raises the question: are we ever going to know who patient 0 was, and are we ever going to know what the actual origin of COVID-19 was? You can imagine that, if we did in China uncover what those facts were, they might be a little bit more reluctant to say what they are now after the verbal sort of spat that's been going on between the US and China.
Look, China has made huge strides in trying to contain this COVID-19. Italy's death toll has now surpassed that of China. So it just tells you, puts into context what the world currently is going through. Patrick Fok, live for us in Beijing, China. We thank you very much indeed. Be well. Look, we're going to take a quick break, but I just want to remind you about our question of the day. The regulations that's been in place here in South Africa, it's gazetted with regards to the sale of alcohol, the certain time limits with regards to the sale of alcohol. We want to know from you, what's your thoughts with regards to this? At the agenda _SABC. Remember, we're opening the lines as well in a short while. That number is 011-714-6841, 011-714-6841 or 6842. We would love to hear from you. We're going to get much reaction with regards to how COVID-19 has changed people's lifestyles. I want to talk to the National Director of the South African Jewish Board of Deputies, and find out how that community is coping with COVID-19.